Thank you, Priya. Now I will talk on the recent advances in neuro ophthalmology. Already we are running short of time, so I'll be a little fast. So I'll go disease-wise. So coming on to the inflammatory optic neuritis, the latest kid on the block is the MOG antibody. Antibodies against the myelin oligodendrocyte glycoprotein. These are associated with unique acquired central nervous system demyelinating disease, termed as MOG-IgG associated disorder or MOGAD. Now we have an article in Frontiers that differentiates between the MOG antibody, MOGAD, NMOSD, and MS. Now, neuroimaging are typical with MOG antibodies, and now you can see the figure. It includes a long enhancing segment of the optic nerve, including its orbital and intracranial portion. We can, in the T-weighted image, we can see the patient with bilateral simultaneous anti-MOG antibody-related optic neuritis. Note the marked enhancement of the orbital portion of both optic nerve. This is not typical of the findings in idiopathic or MS-related optic neuritis. Then the glial fibrillary acidic protein. Now, meningoencephalitis is the newly described entity. It presents with bilateral optic disc swelling, and GFAP IgG in the CSF is found. Now, these tend to be very steroid responsive. Coming on to the Leber's hereditary optic neuropathy, as we know that the gene therapy continues to undergo development, the latest drug to come is ID-Benon, and it is available in India by the trade name of Raxon, and it is the newest thing. Then this drug helps not only to improve the visual acuity and amplitude of VAP at the baseline as already proved. Another thing is acute retinal ischemia, that BRAO and CRAO should be considered equivalent to stroke, and they should be treated as a medical emergency, and the patient should be referred immediately to a neurologist. Now, subtle retinal vascular changes have the predictive value of stroke, and nowadays we have even the non-mydriatic fundus photography, so this can very well be recorded in the OPD. Now, another is the dural CCF. Now, this is article from our institute, and endovascular embolization is the preferred treatment with excellent short and long-term outcome. So this case, MRI T2 weighted image shows mild proptosis on the right side, dilated SOV, and endovascular treatment was done with coiling. So we can see the selective cannulation of the feeding artery with microcatheter for embolization with PVA particle was done, and post-embolization there is no filling of the fistula. Another case where super selective cannulation with tip of microcatheter at the fistula site was done, and post-embolization again there was no filling of the fistula. Coming on to the direct CCF, in this, this is another article from our institute done by a neuroradiologist, the endovascular management of direct carotid cavernous fistula. So there is evolution of cost-effective sandwich technique. In this technique, that is the parent artery occlusion, the principle is to trap the fistula side, cutting off both antegrade and retrograde blood supply to the CCF. It is a cost-effective technique with more fiber thrombogenic coils are put in a sandwich manner. This case, she presented with proptosis and chemosis, which was bilateral. DSA shows direct CCF, then parent artery occlusion with multiple coils was done, and there was complete resolution of proptosis and chemosis with residual 6-nerve policy on the left side. Coming on to the varices. So this study again from our institute, this study presents microcatheterization of orbital varices via inferior petrosal sinus cavernous sinus ophthalmic vein route with injections into the distal ophthalmic vein. Coiling is basically done to disconnect the venous communication. This 28 years female, she presented to us with intermittent left eye proptosis, which occurred on bending forwards and straining. So there was no deficit in vision and there was no fundus defect. MRI showed intracoronal hypointense mass on the left side. DSA showed opacification of both inferior petrosal sinus with opacification of cavernous sinus. Few detachable coils were placed in the varicose mask. SOV was coiled to cut off the varices from the central nervous system. Now coming on to the IIH. IIH, the treatment option for IIH begins with weight loss and include diuretics such as acetazolamide. Surgery works by reducing ICP. Optic nerve sheath fenestration is another option, which is now practiced. Shunt procedure, we have lumboperitoneal shunt, ventriculoperitoneal shunt. Endovascular stenting of stenos transverse sinus is another option we have now. So this is a case again from our institute, IIH with transverse sinus stenosis, and which was treated by angioplasty and stenting. Now coming on to the RNFL and GCIPL thickness in OCT. OCT again is another important entity that has come up. It correlates with the axonal loss, it correlates with the visual function, with pain, atrophy, and multiple sclerosis. It can predict disability, it can also be a predictor of quality of life. So GCC is especially helpful in compressive lesions. GCC is more sensitive than RNFL and even visual field testing. Now this article from our institute, another one, this was to determine the alteration in GCC and its relationship with RNFL as measured by the spectral domain OCT in pituitary adenoma cases, and also considering and also correlating it with visual fields. So we concluded that GCL-IPL is a sensitive tool to detect early anterior pathway changes in chiasmal compression in pituitary adenoma cases. Now, this is the RNFL analysis of one of the study patients showing improvement in all parameters except nasal quadrant in right eye 1 year postoperatively after pituitary adenoma removal surgery. On the right side, we have the GCC of the same patient showing improvement in the parameters. Now, coming on to the OCT angiography, it has revolutionized neuro-ophthalmic practices with ever-advancing technology. It's a three-dimensional motion contrast cross-sectional image that is produced by backscattering of light in the retinal vascular and neurosensory tissue as moving RBCs are contrasted against the static neurosensory tissue. Now the important thing is no dye is needed in this procedure. So this is an example how it can help us. OCT in the non-arthritic ischemic optic neuropathy in the left eye and in chronic optic neuritis involving the right eye. Note that there is reduction in disc and peripapillary vessel density in both pathologies. Although there is reduction in peripapillary vascular density in all optic neuropathies, significant and profound peripapillary capillary loss relative to RNFL thinning may suggest an ischemic etiology. Now, in giant cell arteritis, tocilizumab is the newest thing, and it is an inhibitor of IL-6 receptor alpha. It was approved by FDA to treat GCA and is freely available in India. Multiple sclerosis. Now we have ocrelizumab for the treatment of multiple sclerosis. This is the newest drug that has come up. Now, virtual reality digital spectacles, these are another new thing that has come up, although we have not used it till now, but we are looking forward to use it. So, thank you so much.